Thank you, Chairman, and I greatly appreciate Dr. Shenfield to give me this chance. In Japan, the incidence of uterine cervical cancer is increasing in young girls, and also incidence of HPV infection, especially for high-risk type of HPV infection, increasing in young female generation. As you know, we are now two types of HPV vaccine are available. Bivalent HPV vaccine Savarix and quadrant HPV vaccine Gardasil. In Japan, May 2010, Savarix and Gardasil are introduced to Japanese females, and April 2013, female aged 13 to 16 years are legally required to get this vaccination, and its cost was fully covered by the government. Soon after this widely introduction of vaccine, a high incidence of limb pain and weakness frequently associated with violent tremor was noted, and that All Japan Coordinating Association of HPV Vaccine Sufferer was established. Therefore, at the end of June 2013, only 3 months after widely introduction of HPV vaccine, the Japanese Ministry of Public Health, Labor and Welfare stops the recommendation of HPV vaccine. This is a Japanese newspaper showing the stopping of recommendation of this vaccine, and Japanese girls showing an abnormal gait posture are coming to us. Adverse effects after HPV vaccination are composed of 3 different conditions. 1. Autonomic, especially peripheral sympathetic nerve dysfunction. 2. Chronic regional pain syndrome, CRPS. And finally, brain cognitive dysfunction. Patients showed variable or diverse combination of 3 different conditions. I'll show you the representative cases. This 13 years old girl received an initial vaccination 2012 and finished third vaccination 2013. 2 months later, she suffered from headache, vertigo, limb tremor and pain, and difficulty walking, and could not go to school. She visited several doctors, all suggesting that the cause of her illness was psychogenic. And 6 months later, she was referred to us. On 2 table tests showing that she was suffering from postural orthostatic tachycardia syndrome. That means increase of pulse rate more than 30 beats per minute after standing. This one. Orthostatic dysregulation was divided 2 types. One is orthostatic hypotension, and another one is postural orthostatic tachycardia syndrome, shortly called POTS. As you know, POTS is a very unique disorder and not so common in young female. From Denmark, this paper shows that POTS might be an adverse effect of vaccination against HPV. This is a visualization of peripheral sympathetic nerve terminal on myocardium, and both patients showed denervation of cardiac sympathetic nerve innervation, and also the patient with POTS occasionally lead to chronic fatigue syndrome. And IASP diagnostic criteria for CRPS, it composed of 4 factors, especially for unexplained severe limb pain and allodynia and change of zoomotor activity are very important. This is another case. 15 years old female received third vaccination September 2011. After 6 months, sharp pain in eyeball and double vision occurred, and subsequently she fell down due to transient left side hemoparesis. After that, she had been suffering from unpleasant pain and clumsy movement in the limbs. This is a thermography showing decreased skin temperature in the distal parts of limb, especially in foot. This is a digital plethysmography, or skin temperature decreased in both hand and foot, and also waves of arterial waves showing flattening in finger and toe. After infusion of prostaglandin E1, this is a vasodilator, you can recognize arterial wave normalized and skin temperature significantly increased. So this is a dysfunction of bus motor control of sympathetic nerves. This is a typical limb myoclonus or limb tremor in the affected girl. This limb movement disappears soon after 1 month or 2 months after starting of disorder. This is a transient phenomenon, not permanent. We examined intracutaneous nerves by electron microscope. We biopsied finger and toe skin biopsy, and arrow indicate intracutaneous nerves. In the intracutaneous nerve, two showed intravascular edema and loose connective tissue bundles. This is an electron micrograph of finger. Please note this area, enlargement showing true unmyelinated nerve fiber, showing electron-dense material. This is an enlargement of unmyelinated nerve. This is a degeneration of unmyelinated nerve axon. This is a tool, we can identify large area of unstructured area. This is a severe edema. And this area showed loss of all nerve fiber and increased connective tissues, indicating severe degeneration of nerve tissues. So we first reported This paper, peripheral sympathetic nerve dysfunction in adolescent Japanese girl following immunization with HPV. This is our first description. Then we noticed the delayed appearance of brain cognitive dysfunction, especially learning impairment. This usually appears after improvement of limb symptom, usually associated with sleep disturbance, hypersomnia or insomnia. This is one representative girl, she received third vaccination July 2013. September in this year, pain and unpleasant coldness appeared in both arms, causing difficulty in writing. February next year, she suffered from marked general fatigue, bowel dysfunction, tachycardia, hyperventilation, and irregular menstruation. April, she had severe headache, short-term asthenia with aphonia, transient memory loss, difficulty in concentration while studying. Thus, she frequently absent from school. We checked her wake sleep. Verbal appreciations and hearing are normal, but performance status was decreased. 3D SSP SPECT showed patchy focal hyperperfusion, especially medial side of brain. So, last year, we reported that a summary of our experience with this possible side effect after HPV vaccination. We examined number of patients like this. Clinical summary of 163 cases visiting us, age distribution at age at an initial vaccination and the type of vaccine. And to correct this condition exactly, we proposed diagnostic criteria. This included typical clinical manifestation and also typical objective finding. And we define that. Definitive case, more than 5 types of 10 major symptoms and 3 of 6 objective finding, and no exclusive condition. Probable case, more than 5 of 10 major symptoms alone. So, among 163 cases, 70 cases were diagnosed, and definite 30 cases, probable 40 cases. And these cases, common symptom, general fatigue, headache, widespread pain, limb shaking, dysautonomic symptom, motor dysfunction, and abnormal sensation, sleep disturbance, learning impairment, and menstrual abnormality. These symptoms are major symptoms. And also, objective symptoms, hypertension, orthostatic intolerance, decreased skin temperature, flat and distal plethysmography, and abnormality in cognitive function tests, and also focal abnormality, cerebral blood flow on SPECT. Age distribution of a patient diagnosed having HPV vaccine-related symptoms. Age distribution and at an initial HPV vaccination and age at the development of symptom pattern are very similar. And also, temporal relations between HPV vaccination and the development of symptoms in the patient diagnosis of this disorder. Period ranges from May 2010 to December 2016. Peak period of injection of HPV and appearance of symptoms are very overlap, and stop of recommendation of HPV vaccination, the patient with symptoms rapidly decreased, and 2 years later, October 2015, after October 2015, no new patient appeared. So, and also, 70 cases diagnosed as side effect of HPV vaccination. Appearance of symptom, this is a very important point, After first injection, 16.7% complain. And also, second injection, 29.2% complain. That means about half of the affected girls complain symptoms after the end of second injection. However, they had received third infection, which worsened the symptom. The reason is the following. This vaccine becomes effective after third injection. And also, in the limited period, you can receive this expensive vaccine without payment. Both two reasons are continue to vaccination. Last year, we reconfirmed our previous data. In 2017, we newly diagnosed 11 cases, but all 11 cases received vaccine before May 2013, and the symptom appeared May 2014. Recently, no new patient appeared. That means stopping of HPV vaccination, no patient appeared in Japan. And also, in Japan, this episode had already subsided. Summary, using our new diagnostic criteria for adverse symptoms after HPV vaccination, 163 patients were examined and 72 were diagnosed with HPV-related symptoms, about half of them. And main symptoms consist of CRPS, autonomic and cognitive dysfunction. The time to onset after first vaccine dose showed a wide range. The period of HPV vaccination in Japan considerably overlapped with that of the development of unique symptoms in the vaccinated patient. Our team covered whole Japan, Hokkaido, from Hokkaido to Kyushu. And this is my final comment, I recognized that HPV vaccination is useful for prevention of uterine cervical cancer, and thus, I am not against HPV vaccination. I only would like to show the possible side effect of HPV vaccination. This side effect can be considerably reduced by the careful use of this drug. Thank you very much for your attention.
Thank you for this nice presentation. The paper is open for discussion.
Tamara Tuminen from Finland. Can you please explain how do you treat your patients? What is the treatment scheme? Thank you.
Yes. There are 3 treatment methods. One is giving anti-pain drug, and another one is steroid pulse therapy, and the third immune absorption therapy or plasmapheresis. But basically, this symptom will decrease or will disappear within 2 years after onset. Probably, if this, natural cause decreasing,
Hi, Catherine from the United States. I think you indicated that a cognitive dysfunction may appear a year after the appearance of autonomic and other symptoms. Do you have a hypothesis as to why cognitive dysfunction was last to appear and appeared long after all of the other symptoms mentioned?
We don't know exact mechanism. I'm sorry, we don't know exact mechanism. And all our hypotheses, I'm sorry.
Mercedes Garcia from Argentina. Your final recommendation was the careful use of the drug. What does it mean?
Yes, in limited Japan, doctor or other medical staff who knows no information of this vaccine, So, as explained, if girl complained symptom after first injection, and if we would stop the following injection, symptom did not worse or did not appear so seriously. So we shared this information and very careful use of this vaccine. The same event will not develop, I suppose. That's me.
Hi, I'm Eugene Robinson from Pennsylvania. Thanks. So I think your finding is very significant. 72 out of 160 patients have developed such severe symptoms. So I think you mentioned earlier, were symptoms reversible after a certain period of time? So the patients actually return to normal?
Yes. We are following up these patients, we send an enquete and to ask their present situation, So more than 60% symptoms are improving, and about 70% they come back to going to school. So their daily activity are very improving.
Because it's good to know, because, imagine the patients and parents, they're devastated, So the second one quickly is, if this is happening in Japan as a result, the policy has been canceled for immunization of HPV. So do you see evidence of other countries in terms of the different populations and similar symptoms and similar development of this kind of thing?
Yeah, this is a very important question for me. But as repeatedly says that I am not against HPV vaccination, but started or not, I have no comment, and government should decide this point. Okay.
Mm-hmm. Thank you.
Last two questions.
Thank you for your presentation. Andrea Militaro I work in France as a pediatrician, and I observed some symptoms, as you mentioned, like hypothermia, sleep disorders, and even if impairment of speech development after vaccines, but not after HPV vaccine. So my question is it linked to the adjuvant or to the peptide of the virus? And secondly, the second question, I was shocked about the percentage of the third injection, and my question: how should we act after first or second booster of vaccine? If we see the symptoms, should we repeat the vaccine or not? Thank you.
Yeah, very important question. And as you know, brain dysfunction, fat is a very important factor producing brain dysfunction. HPV peptide itself or adjuvant, we don't know. We don't know. I'm sorry. And also, you know, in introducing or starting this vaccine to girls, doctor and nurse and other medical staff should know this vaccine more correctly.
Okay.
So
We must have the last and quick question and quick answer, please.
My name is Dimitri Poddige. I am a pediatrician working in Italy now, Kazakhstan. My question is, did you notice any potential clinical or family history risk factor to develop this kind of reaction in your patients? I mean, of course.
I'm sorry, I do not have such special history or past history or family history, but we are now checking.
Okay, thank you very much.